This year, for the first time, the cost of buying insurance may be cheaper than the penalty for being uninsured. I'm Bryn McBride of ABC for Health. The individual mandate out of health reform says that everybody has to have insurance or pay a penalty. Now, the type of insurance people can have can be employer-sponsored insurance, it can be Medicaid or Medicare, it can be a marketplace plan or another qualified health plan. Those people that have this insurance will be covered and will not have to pay a penalty for being uninsured. The purpose of the individual mandate is to encourage people to be insured, both healthy and both those with pre-existing conditions. The individual mandate and the elements of health reform working together say that insurance plans cannot discriminate against somebody for having a pre-existing condition. Also, we need to make sure that healthy people get into the marketplace as well, and thus the individual mandate, to make sure that people have insurance. Now, there are some exemptions from this individual mandate. If you're very low income, if you have coverage that isn't affordable and you pass an affordability test, this is largely looking at the cost of your employer-sponsored insurance. If you claim a hardship, or if you qualify into certain groups that are exempt from the individual mandate, you do not have to be insured, and you also will not pay a penalty for being uninsured. These exemptions are quite limited. They do apply. There is paperwork for things like claiming a hardship exemption, for example, or proving that you're part of one of these groups that is exempt from the individual mandate and the penalty. But it also means that you're uninsured if you fall into some of these exemptions. So there is motivation to seek out if maybe a Medicaid program might be appropriate or some other health care coverage. Now, for everybody else, there is a penalty for being uninsured. Let's take a quick refresher look at what that penalty is. If we were to look at just the straight numbers, the penalty is essentially 2.5% of your family's income in excess of your tax filing threshold. So there's a lot of math here to figure out what you would owe if you were uninsured for the calendar year. Now, there are top limits and bottom limits to this. There is a top limit of just over $2,000 per family as a penalty for being uninsured. There's a different dollar amount for adults than children for being uninsured, and it's also prorated. So if you're uninsured for half of a year, you're not going to be paying the penalty for being uninsured for the entire year. So there's a lot of math that goes into calculating what this penalty for being uninsured would look like. It's reconciled at tax time. You do have to indicate on your taxes if you had insurance in the past year, and know that those limits can be up to $2,000 for family. We're talking about it now because as people are shopping for insurance for the first time for 2018 coverage, they are finding, and the Kaiser Family Foundation has issued a report on this, 54% of the subsidy-eligible uninsured could actually purchase a bronze plan for cheaper than that penalty that we just talked about. You can buy insurance for the whole year for your family for cheaper than what the penalty would be for being uninsured for the whole year for your family. Now, there's even a segment of this population that could get these cheaper plans that would have a bronze plan that costs less than the tax penalty. So there's 54% of subsidy eligible people who are uninsured that could buy a bronze plan for no premium. And there's an additional 16% of people that could buy a bronze plan for some premium that would still be less than the tax penalty. So altogether, 70% of subsidy eligible uninsured individuals, we're talking almost 6 million people, are eligible to purchase a bronze plan for nothing or for something less than the penalty for being uninsured. This is the first year this has happened, and it's taking advantage of some of the political rhetoric that's been happening. Because of the defunding of cost-sharing reductions to the insurance companies then increased their rates on silver plans. When they increased premiums for silver plans, they had to increase tax subsidies for silver plans. But in this whole adjustment of trying to make this work for insurance companies to balance out what's happening politically in Washington, they ended up where there were other plans, such as gold and bronze plans, that actually came down in cost. This is why we always stress it's very important to shop. Consider, if you think health insurance is not affordable for you, Go shop and look and see for yourself and see if what you're thinking is actually true. For a lot of people, like what the Kaiser Family Foundation has reported, they're getting onto healthcare.gov. They're finding an insurance plan that's a lot cheaper than they thought, and actually cheaper than being uninsured. And of course, cheaper than the consequences of being uninsured. We're just talking about dollar amounts here, premiums versus penalty. We're not talking about those surprise bills where you're uninsured, you have an accident, you get to the hospital, and your bill is $10,000. We're not even talking about that type of situation. We're just comparing the premium cost for the year to the penalty for the year. So do some shopping, consider some of the consequences of being uninsured, and consider the prices of buying insurance for the first time. Open enrollment does run until December 15th. You can enroll at healthcare.gov. You can read that Kaiser Family Foundation report. We'll share that linked with you. You can also view the Kaiser Family Foundation penalty calculator. Because there is a lot of math involved, you can see exactly what that penalty would look like for your family if you were to go in the alternative and stay uninsured. Of course, healthcare.gov is the place to sign up for insurance. Remember, open enrollment only runs until December 15th. If you have questions, you want to send us an email, we can talk about this more. You can always visit us at healthwatchwisconsin.org. Thanks for joining us.